Welcome to today's webinar on HR shifting focus from sick care to preventive care. And I'll be moderating this conversation today. Before we dive in, I wanted to share some numbers. Every year, 8 to 10 employees per thousand are faced with critical health risks like cardiac conditions, advanced diabetes, undetected cancers that could be caught through early screenings. Early intervention doesn't just save money, it literally saves lives. And in today's talent markets, top candidates choose between similar salary offers. Comprehensive wellness programs and well care programs are often the differentiator. I know you all will agree. So today we have with us three exceptional panelists, Sandhya, Tanmay, and Aditya, who will share their real world experiences that they have used and they have experienced in transforming employee health from reactive to proactive. So, welcome, Sandy and Aditya and Tanmay. Pleasure to have you as part of this panel today. Over the next 1 hour, we will cover three critical areas: how to design effective well care programs, how do we implement them successfully, and very important, how do we measure their impact? So, are we ready? Should we begin?
Yeah.
Okay. So, let's start at the very beginning. Let me just move the slides. Okay, the identification phase. You can't improve what you don't measure, right? This means understanding the workforce demographics, analyzing claims data, conducting biometric screenings, accessing lifestyle, risk factors, and so many more. So, here's my question to all three panelists. Walk us through your approach to gathering baseline health data from employees. What's been your most effective method for encouraging participation in screenings or health risk assessments? Tanmay, you want to go first?
Yeah, sure. See, first of all, if I really want to answer this question, the moment you will tell someone that we are supposed to gather some baseline health data, health itself, the moment you put across, there is always a double-edged sword. Uh, Few people who are receptive in nature, who are having a better level of awareness, they will not be feeling offended about it, why these people are asking for this type of databases. But there are also another set of people who will be a little bit skeptical in terms of uh, why this exercise is being done or what is the use of it, what is there for me. That's a very normal phenomenon will come, is likely to come. Honestly, if we really want to encourage, or you can say you asked effective method or encouraging the participation, the moment we come with a flexible arrangements, rather than enforcing something, if we are coming up with some solution where there will be either flexible appointments or let's say we do something, let's say on-site screenings kind of things, okay, or we can go at home testing kits kind of it, something which we have to go out of the box, because otherwise uh, there is a good amount of awareness is there after COVID happened, and a lot of other things people have started becoming aware about their overall preventive healthcare point of view on a personal note. But still, the moment it comes into organizational context, it's better to give a assurance that first of all that we are here to help you out rather than enforcing something that no, you have to go for this thing, or suddenly we are trying to link it with some additional incentive to go for it. So that's my opening remark from my side of it. Yeah.
Hi, Sandy, you want to add here?
Yeah, I agree with Tanmay. I think a couple of points that I would like to add is one, I think now it's become definitely more preventive and proactive, which means you don't need to really nudge them to give the data or to take the survey or to, build the baseline data, which means they are more active. They would want this to be done for them, or which means like Tanmay mentioned, after COVID, the awareness has been much more than being scared or terrorized in terms of what my health would be or what it might look like. And, I'm afraid to go get a health checkup done. Now it's more mandatory. Now it's more proactive. They would want this data. So I think the nudge that we need to push from employer standpoint has comparatively reduced. I see, at least, in the size of the organization that I'm leading, beyond 80% of the people, I see them being very proactive, taking their health checkups quite seriously, making sure that, they are utilizing the benefits that we are offering, be it, whether if it's an engagement activity, whether if it's, getting necessary vaccinations due in time, whatever may be. I think they are much more proactive, which means the focus on health has rapidly shifted. The needle movement has been, significant after COVID, which is very happy. So, to the topic of preventive care, I think we are in the right direction, heading towards the right, light of tunnel. So, that's what I would like to add.
Perfect. Vikasha, if I may, just let me build upon this. A couple of interesting perspectives from Tanmay and Sandy both. I'll just address the audience from the point of view of an ecosystem player, if you will. In our role as benefits administrators, we do facilitate and provide for health checkups and other kinds of baselining to our customers. Sandy, I was very happy to hear that you had an 80% plus sort of experience with employees being proactive. I think that's like a very, very progressive mindset that your organization is blessed to have, or the employees. I can tell you, like, we try to have health checkups as part of every company's benefits onboarding cycle on a pretty much an annual basis, if not more. And we rarely see it crossing 30%. 15 to 30% uptake is generally what we've observed, in spite of, and this is after making a lot of efforts to make sure that there is a home service. So somebody comes to home, picks up the sample, you get the report back very conveniently, and assuring them about privacy of their data and so on. I feel, Pinkasha, to your question, like, it's still partway there. I saw Tanmay nodding. Maybe he's had a similar experience that driving participation beyond a point is a little tough. But what I'm noticing is definitely, as Sandy said, little more awareness and even proactiveness, even amongst HRs, to kind of facilitate this and people taking it more seriously. And the other thing, I'll just reflect from the vendor ecosystem side. What we are seeing, of course, there is the convenience factor of having everything at your fingertips and a home pickup, etc., which is well organized. There is some new technology developments which I don't think as employers we are probably yet fully using. So Philips has recently launched something called a heart print, which is a non-invasive cardiac risk assessment. And then people have their Apple and Samsung watches. So I think there is still some way we could go to harness some of this personal tracker information to do better baselining. But I think there are some cross systems integration challenges as well as privacy challenges that we might need to solve for.
So maybe just adding to that, Aditya, and just maybe clarifying. When I say 80% and beyond, I'm talking about specifically the industry that I'm in currently, which is a clinical research organization. Right? If I were to talk about my previous organizations, which is banking, I am sure that the numbers would reflect very much to what you said, which is 30% or maybe even lesser. However, I think we have really, from HR standpoint, the engagement that we have driven has been quite successful in terms of, let's say, if we do a annual, let's say a team dinner or lunch or maybe a gathering, we make sure that, this is a part of it, so that, while they come and enjoy, there's also a part of, your health checkup, which is offered. And then there's a table at the seat. So why don't you just finish that and then come here, enjoy the party? Or it could be a part of, a family gathering that we do, so that, we can have more participation. So we've been trying to see how we can encourage more participation or offer discounts. And I'm sure these are some things that are not new to all of us. Offer discounts in terms of, if you do this an early bird offer, then you have a discount, so you can go get it done for you and for your family, etc., etc. So yes, I think we've been trying to see how smartly can we get more participation. Again, having said that, it's also the industry that it matters in terms of what's the core business and how do we want to bring in that aspect of communication and encouragement and all of that. So yeah.
Amazing. It's great to hear about some ways you're tweaking. In fact, Tanmay, any interesting story of a message? Because I'm always struggling, frankly. Should it be a fear and doom message saying, please get it done? You, who knows, you might have something that goes undetected, etc. Or should it be like positive? Any experience in sort of messaging to employees or nudging them about it, which might have worked well? Be lovely to learn from.
Yeah, I can share one of the incidents. My current organization, when I joined, people were a little bit not sure in terms of whether we should really go for this. We initiated all the 40 plus age years guys who should be undergoing the annual health checkup. And people were thinking, I don't know why this new initiative has been started by company. I'm representing a sector where this is not a very normal practice, barring the some of the very evolved organization. So obviously, I had to lead from the front. I myself said, "Okay, okay, no problem." We had some tie-up with one of the organization. I underwent through. Now the real rubber hits the road when the reports came. Now, obviously, there are some things in terms of vitamin D, B12, and some of the other aspects, even in my own case. So I was not shying away from telling this. The moment this report, again, it was a lot of hush hush whether this report should be shared or how to share and all these things. So suddenly, one of my colleagues came in one typical traditional way of envelope with this thing report, and then he said and came. I said, "What's so secret about it? Just it's okay." So afterwards, I had to literally scan it and I had to share this thing because I thought ki till the time my own team is not getting convinced. I said, it's okay. I'm having vitamin D deficiency, B12, and some of the other aspects. Okay. So I said, okay, these are the things. It's my own report. Now, it's not that I'm going to now sit on it. I'm going to act on it, how to really come out from this particular things, whatever measures which needs to be done. So I think there was a little bit taboo, which was associated with it. Ke what will happen to that results afterwards? So yeah, I don't know. Matlab, it was a very matlab, surprising moment for a lot of people in my other colleagues. They said, "Arey, apna khud ka report is displaying like this," but it's okay. There is nothing to share. But afterwards, I will not say that it was a great success, but at least it encouraged, triggered people to go without any inhibitions, and they underwent that particular thing. So I think fear will not work, Aditya, to be very honest with you. At least in my till date, three, four different organizations where I worked in the different kind of industries, till the time the spark is not coming from inside or the sense of urgency has not been created, people will not go because of fear. Even though you are doing all these things free taste, okay, you're not asking them to spend from their own pockets, but still fear normally does not work in my till date experience. Yeah.
Oh, thank you. That's very interesting. If I may, Pinkasha, for a second, sir said something very interesting which really struck me. It's when the report lands to you, that's when the rubber hits the road, right? And I didn't mention, but and we haven't really seen it drive adoption yet. But one of the things we have tried to work hard on is because we realize that's a moment of truth. I've got the report now. What do I do with it? Even if something is out of range, is it really serious or not? So we've been trying very hard to link that to a doctor consultation pretty seamlessly, via telemedicine. So you can just pick up your report, immediately get into a chat with the doctor and try to understand what you should be doing. And yes, sir, as you mentioned, that is a very important piece probably to link up so that people don't get flustered, saying, okay, now this is scary and I don't know how scared I should be, what to do.
I agree. And just to add to that, right? People think that just getting annual health checkup is the done goal, but that's just a stepping stone. So it's more in terms of, understanding, analyzing, and it's not, and I think people just value vitamin D or B12 to be, okay, it's just a vitamin D or B12, but it does impact in the longer run. Now in this age and era, and maybe if I'm just taking it off topic, please do cut me short, but in this age and era, people are not focusing on, short-term benefits. It's not about, okay, I get this done, what's in it for me? They are definitely focusing, and like I said, the shift has been quite significant. The focus is now on longevity. What can I like? I see a lot of data in terms of people who have really shifted their gears and fitter under 40, fitter under 50, fitter under 60, and then the trend has now been more in terms of how long can I sustain doing what I'm doing, and how can I be as fit as possible as and when I grow. So I think that being the focus, at least, towards positivity and longevity, I think it makes sense that, they start with that, understand it's not the end goal, but that's where, having the doctor consultation, knowing everything is all right, or is there anything that they need to focus towards, and knowing that this is not the end goal, and, you just get a check done 1 year and you're like done with it, and then that entire page is like closed, shut shop. No, that's not the end of it. So educating them, that is also important. Yeah.
So, Sandy, just a follow-up question here. So, now that you're mentioning that it's just a stepping stone, what more things can an organization do apart from just the basic health screenings? What more it should it be more focused on mental health as well, financial literacy as well?
Absolutely. I think you've hit the nail, right? When we speak about health, it's just not only your annual health check and the reports that talks about what your, levels of hemoglobin or anything. It's also your mental health. How is the environment or the ecosystem that Aditya mentioned, the ecosystem that we've created in your work environment, which supports you both mentally, physically, which is your work-life balance, financial stability. You may be earning whatever earning or salary range that you're in. You also need to understand how is it making you financially stable, helping you in terms of other aspects of your life, of, whatever may be your goals. You would want to buy a home in certain period, you would want to buy a vehicle, or you would want to afford for your family's, care. How do you afford for it? How can you manage your financial stability? Engaging them with multiple conversations, or guiding them through, or having experts come talk to you about it every now and then, it's very important. Again, you have a season, especially when there is a taxation season. We know what to hit the nail, and that's where we bring in the financial experts. It's the end of the year, people will go, on holidays or binge eating. That's when we bring in someone, who's much more experienced on nutrition aspects, so that, we are able to focus on that. If it's the new year, again, you will need someone to like help you with goal, for your resolutions and goals. So somebody who can bring in a complete holistic picture of, what nutrition is, what your sleeping pattern should be, what your other mental aspect should be. Apart from these, even activities, and this is needless to say that every organization does, different things. Like, I could either have a yoga session in office, or I could give cult passes, maybe, to ensure that they're utilizing it, make sure that they're utilizing it, and for the benefit of all, either physical, mental, wherever it's more applicable. So I think it's not just one size that fits all. You will first have to know what demographics that you have in your current organization, and what can cater to each of those demographics, and how can that be applicable. What different ideas do you need to, bring in, so that you can keep everyone engaged, is something that you need to play around, and then you identify that through a survey of whether it has been helpful, whether that's been receptive or not. I think that's how you would identify that. Sorry, Aditya, you had something to add on.
Yeah, just wanted to build on a point you raised, which I find super pertinent, which was the point around one size not fitting all.
I'm sorry, your volume is very low.
I think it's
I don't
just
know if it's me, or I don't know if it's
uh,
everybody.
it's probably me. Let me be a
Okay.
bit louder.
Now it's fine. Yeah.
So
Yeah.
you mentioned one size doesn't fit all, right? I just wanted to build on that a little bit, looking at sort of the health risk assessments that we see, and what is typically part of a health checkup. I think you also mentioned it's like a first step. So just pointing out that the diagnostics available these days are fairly advanced, and cost is falling all the time. And our conventional thought process of a health checkup stops somewhere.
Yeah.
But there are new things like cancer screening, women's health, right? Specifically around PCOS, fertility, etc., old
Right.
age,
Yes.
and also your preconditions.
Yeah.
So one of the things, Pinkasha, to your question on what else besides a basic health checkup, I think there is the capability now to be a little bit smarter and sort of expand it beyond the basic parameters into some more relevant parameters as per age, gender, and history, which to me feels like a very logical next step that organizations should consider taking.
I completely second that. I completely second that, and agree that our basic health checkup is even now asking them to, just like you said, we have a home driven test that can be samples that can be collected and then delivered to you. A report can be delivered to you on an email. So it's the comfort that we have chosen over the requirement or the need. But going exactly to your point, the test that you're talking about is not something that can be home delivered. We will need someone to, like, take their time out and then go to those diagnostic centers or maybe hospitals to get those tests done, because it's not as advanced as it can be that you can get these data. But I think our what do you call, if I may say, a struggle has still been that getting them to do the annual health checkup itself is quite important. Probably that we still consider as at next step, but that's something that we definitely need to focus on or shift the needle towards. Yeah.
And how important does a partner and having the right wellness partner or a health partner play here to implement all the things that you want to have the best life productivity for your employees?
Well, probably I'll answer and then probably Aditya and Tanmay can, follow me. It's quite significant, right? Like, it's not only for health partner I'm talking about. No matter any partner that you choose, whether if it's a different vendor for any other services or anything that you choose, if as an employer, your objective is bringing care for your employees, and when I say care, it's a holistic care that I'm talking about, like I mentioned, financials, mental, physical stability. If that's your objective as an employer, and building a world class employee organization with high level of productivity and then growing out your business, it cannot happen without bringing in the right set of vendors who has the similar wavelength or understand industry best practice, have understood what is the requirement of your organization, knows the demographics, curates the engagement programs or curates those packages for you, which helps drives innovation innovatively, your benefits that you offer, and time and again reemphasizes of the importance of it, calls about how it needs to be done, or what other surveys or activities that you can bring on, so that you can reiterate the benefits every now and then, because not necessarily everyone would remember what's been offered at the beginning of the year or when you sign the contract or the agreement. So it's not just about bringing a right partner, it's also every time, and now you will have to re-emphasize what we offer, what is the benefit. Did you know that we have this? Did you know we have this? So I think it's reminder that has to keep running throughout the year, and not just at one time that happens. So it's quite important that you have the right partner. One second, they really need to understand the business to know what the offering needs to be. Like I said, it has to be curated. It can't just be, like I said again, one size that fits all. So they just bring in whatever is the best practice that's there in the market and then says, why don't you copy paste and put the same thing over here? So
Yeah, so I can say, see, when we say, Pinkasha, about the partner, I think this partner should be seen like a real, true sense accountability partner. The curation part she already mentioned, Sandhya. So the idea is that it will be too much to achieve at one go. I think it's better to have a top two or three things when we had at a org level, when we don't want to go for beyond three or four goals, okay, for achieving a personal capacity or performance. I think same way it needs to be top two or three goals which should be in line with the, either it might be a specific targeted community, or targeted community does not mean that I'm targeting some set of with a bias. I'm talking about the focused cluster of people, or you can say you can divide into some two or three segments and having a top two or three agenda which needs to be driven. And I think the major responsibility also coming not only on the partner on the one side of it, even from the org level and HR side of it, also to ensure that these things are resonating. Today, if you have decided some goal, the alerts are there, nudges are there. There are varieties of things which partner is doing it from one hand, but we also have to resonate equally with our actions. So then it will be a positive inertia, and everybody will think, okay, needle is moving, we are in the right track, And the moment initial confidence will come after some time, I will not say it has become part of the habit, but still the moment trigger will further drill down, I think it will be, we all will be on a right track. And then it's more about how to maintain that momentum is going to decide. Yeah.
So I want to quickly run a poll and then come back to Aditya with just throwing light on the answers to the poll. So I'm just launching a poll. This is for every audience member. What type of wellness initiatives get you the best engagement? Okay, I see fun activities and challenges that can be done together get us the best participation. So we launched Stepathon at Pazcare, and Aditya, if you would like to talk more about it, and now we're running it inter-company also, intra-company as well.
Yeah, no, absolutely. But before that, I just wanted to like remark upon what we saw in the poll. Maybe it's a small sample, but it feels like team. It's more about a team and kind of creating that positive, maybe a what should I call it, a chain effect or a collective consciousness amongst the team, which might be working better as opposed to addressing folks individually as individuals. Because I saw both kind of group activities is where folks see the maximum amount of response. Now maybe it's because it's fun or it's challenging, or but I mean clearly dekha dekhi is a good way of trying to get people to adopt some of these habits, and I think Tanmay was also talking about it, maybe right from top down. So I mean that's just like a learning for me. As when I'm framing adoption challenges in the future, I think maybe we need to think of team much more. In fact, now that I reflect, some of our most successful preventive care sort of customers, right, or screening, since we're talking of screening, have happened when there's been things like a day-long wellness fest or some kind of an organized themed organization-wide event which has been centered around it. And Sandy also spoke about making it part of office get-togethers, etc. So I mean that seems to be a strong learning, and we should sort of double down on that. I would say it's a takeaway from me. Yes, of course. I mean, stepathons, it was probably number one on the poll or close as well. We've seen sort of great traction, interest coming out of it as a very engaging sort of measure. And obviously, the science behind it also is pretty solid in terms of step count being predictive of health concerns. Yeah, and that's been a good experience. So I mean, we are doubling down in terms of product and service around Stepathon as well, adding functionality to organize your teams, rewards, etc. much better. Yeah, it's a learning journey, Pikasha, for us as well. So I'm thinking the next iteration is sort of build in some team dynamic into other kinds of activities as well, perhaps, and get more people to see each other participating.
Yeah. You guys spoke about vaccines, like seasonal flu vaccine, HPV.
Pinkasha, before you jump in there, are you taking audience questions? I see Sujata has her hand up. You want to do it at the intersection of each one?
Sure.
Let me take a question as well. Yeah.
Let's do that. Yeah. Sujata, please go ahead.
Yeah, hi there. So this is Sujata, and I head HR at a diagnostics company. We are about 150 strong people of scientists and doctors, even clinicians. And coming from the scientific background, all are learned customers for me at the organization. And it was a challenge for us when we decided to embark on this preventive healthcare journey. And as Sandy rightly mentioned, it is more of how do you have a health span, how quality, good health span do you have to have a good lifespan, you know. So what we did was, and our experience is the community challenges work very well and that's my experience. And then we rolled it out to other organizations as well because some of us, the HR group, kind of was enthused by our model. And what we do regularly now is a 28-day challenge. Okay, and the 28-day challenge helps because it is short term, it is quick, and in each week we introduce a habit, which is a small habit to say, but it has a long term impact and it is sustainable. Like a small habit, like you must eat a salad or a kachumbar, koshimbir as we call it in Marathi, before your each meal because that helps in not only weight management but your cholesterol because there's fiber, your sugar spikes are lower and things like that. So even after each meal, that includes even a breakfast. So after each meal, even if you have 10 to 15 minutes walk, that helps. So such small habits, you introduce them over a 4-week period or a 28-day challenge, and which are sustainable. So, they walk away with these small atomic habits, as we call them, which are working at the atomic level to help you sustain in the long term.
And it's
So,
an idea
yeah,
worth stealing. And that's
yeah.
it's a very nice initiative. Yeah. Thank you.
Yeah.
Sorry, Pinkasha, back to you. Yeah.
Anand also raised his hand. Anand, you want to go next?
Yeah, I have a question. See, it's great to hear that industry is coping up with so many voluntary initiatives for well-being of the personnel. But now that was on a basis of the personal individual health. Now, my question is, what is being done when it comes to occupational health? And the sedentary jobs are more dangerous than the active jobs. You sit down for a long time, you have ergonomic issues, you have lower back issues, you have capital muscle syndromes, you have MSDs, right? And now with the paradigm shift due to the enactment of the Occupational Health and Safety Working Conditions Code 2020, which covers all business establishments. Earlier it was restricted to factories. Now it covers every establishment employing 10 or more people. So the paradigm shift in terms of from our personal health care and our metrics perspective to an occupational health care perspective. So what's the strategy? Well, just to let you know, I'm a safety consultant and we work extensively on this in wide sector of industries to deep, high in the sky to deep in the ocean. So this is very significant for us because we work in industries. When we do an analysis, when we do audits, the biggest challenge we have between the technical fraternity and the HR fraternity is how to bridge the gap. There are so many questions which come in, and that's the main reason I joined this conversation too. All right. So if you can throw some light on that, that would be great.
Okay, and Anant, I will try to attempt your question. Okay, because I can resonate a lot of things what you are telling. I'm connecting from one of my factory locations only. Okay, and this code has been introduced few days back, and a lot of discussions are going on. I understand a lot of further clarity will come in next 2 to 3 days time, and followed by that. So I am not going into those codes part, but yeah, to answer your question in terms of see. As you rightly said, it's now industry agnostic. It has nothing to do with only factories. It's going to be across the levels. The strategy which I am foreseeing, I can tell you in my sector what is happening right now. In the foods and you can say beverages sector, what is happening in terms of this thing. Everybody is serious about it in terms of understanding their value chain once again. There are some of the things which are going to be forced, not forced, I will say some of the things which has been already recommended to be implemented in coming days. So we are supposed to now look at the overall proposition in the, you can say, the structure of the proposition from the company side, they really want to relook at it. That's the first response to your question. Second is in terms of if there are few areas, see, we can't compromise on this particular front. We have to avail this. It's not only because of law is telling us, but anyways, we are supposed to do it. Now, organization is trying to understand which are the other areas where we can optimize it and we can give more better focus on this particular front, because at the end of the day, slowly, gradually, everywhere differentiation, even though in manufacturing sector also, gone are the days where you will say, I am having a better machinery or better infra or better things. I am having, even in this sector also, people are becoming more critical. And honestly, a lot of talks are going on in our fraternity that AI machine learning is affecting a lot of white collar guys. I can tell you one thing, 5 years down the line, and it is not only my own opinion, even Anand Mahindra said few days back also, it's going to be that this side of the table, there is going to be more scarcity of talent in coming days. Okay. So strategy is very clear, 3 steps I can tell you in my sector. One is we have to do this, so we have to understand where it is. It should not be considered as a cost, in terms of it should be looking as an investment. That's the first step. Second, easier said than done, but the idea is that how to turn around in terms of overall value chain without affecting the profitability side of it. That's the second part. Third, everybody is looking at it in terms of pure ROI point of view. I can say people are looking at it, how engaged my employees are, how I'm able to retain more people, and am I do something which is going to give a more employee advocacy or brand equity in coming days. I know I'm making a very 3 big things, but in my sector, everybody is extremely proactive. And from Friday evening itself, the moment Modi ji announced it, okay, officially, that this is the things, and there is a lot of positive buzzes going on. And honestly, irrespective of size of the organization in food and beverages sector, everybody is extremely cautious about it, and there is a lot of positive vibes which are going on it. So these are the 3 4 things which we are able to foresee along with my own organization, and we are looking forward how to embrace it, and without any finding we don't want to cut the corners. If let's say for everyone we have to do 40 plus by default annual health checkup, we don't want to compromise. Contract labor hai, abhi nahi hai, 180 days, all these things, nitty gritty, we don't want to go for it. We want to definitely go for it. So anyways, in this sector, lot of other things which were always been considered like an overhead, but now it's going to be like a new normal. So this is my till that understanding in terms of how we are as an organization, how we are responding to this particular challenge which is going to come now. Yeah.
Okay, thanks. Well, I can give deeper insights into that because as a part of the team to comment and draft out this law in India on behalf of CII, CESD, and yeah, so we can talk about it.
Yeah, we can connect offline, and would like to understand better and take your expertise. Thank you so much.
Thanks. Thank you.
Aditya, you wanted to add something?
Yeah, very small one. Sir brought up an interesting point as well. So our customer footprint is a bit more skewed towards white collar jobs, especially technology. And I'm just reflecting over the last year, I would say maybe 1 in 30 or 40 customers has mentioned ergonomics and orthopedic concerns as something they are trying to address. So that's the level of sort of concern I see today. But also I see things like desk yoga and in general yoga becoming a very popular wellness activity. So maybe that's also reflecting that concern somewhere, maybe not in so many words. And so in a white collar scenario, that is one point of sort of probably concern I do see bubbling up, and a bit more and more, right, around ergonomics and orthopedic concerns. Because they do once in a while appear in the top 10, even in terms of the claims cost drivers that we see in our claims analysis.
Also, we've also seen that companies who provide the OPD covers are also seeing 40-50 percentage adoption rates going up. People are using their OPD covers, and that is also in return reducing the hospitalization and claim ratios for companies. So moving on, we've spoken about implementing programs, measuring the right data, having the right data, having the right partner. Now we have to speak about execution, which is also where most programs usually stumble. So let's talk about how do we make it work. I think you've already spoken about like Tanmay was giving an example of himself where he had showcased his report. So, a very important thing that comes in executing these programs is leadership buy in. So, Sandy, Tanmay, Aditya, even Anand, do you want to throw some light on how does it look like in the practice where you can talk about if a leader or a CEO changed the game for your wellness initiative that you introduced? Then we've already given your example. If you have more, happy to hear that.
No, only one thing I will touch base smallly, and I think let Sandhya and Aditya also take over. See, I joined the organization at that time. There are few things which is part of the regulatory requirement. Okay, and somehow we are trying to manage it till time, but the moment CEO understood that there are clear cut metrics which is possible. Okay, there is an assumption in the organization and even the ecosystem for not limited to my organization, that there is a X amount of attrition is by default at that specific level. Okay, and nobody was looking at this type of initiatives. Let's say just to have a food handlers as a, I'm just giving a small example. Let's say food handlers test, though it is a mandatory from a regulatory side of it, but still there are always loopholes. People used to turn around and they used to manage it. The moment they saw that, this is not something which is out of the box, this is something which we are making it like a mandatory. Okay, and the moment they start seeing the result, companies investing on me. Okay, irrespective of, they know I may or may not be working 1 year down the line. Okay, at that specific strata of people I'm talking about, but suddenly there was a set of needle moved in terms of few people who started appreciating. People started referring their other community ke boss, this company has started doing it, even though it is not necessary to do it, they have started doing it. So that suddenly that momentum has really helped organization. And suddenly now CEO this year, okay, this year there's 1 year down the line, he himself came and he asked me कि क्या हुआ, this is now November started, last year you started for this thing 700 people, where are we, matlab, I hope so there is no any issue in terms of you are not going to come back and ask me for the budget. So I think what else you will require? Being a heading HR, I think this is the best part when CEO himself is reminding that last year November we did, and without any this thing, proactively he himself is coming and asking me, I hope so there is no issue in terms of this thing, this side of it. And he's trying to say that you guys have already saved on other areas. Okay, some of the other places you guys have done some good initiatives. So don't worry about this part. Please go ahead and have a base deal and have ensure that everybody is getting covered. So I think it has worked well. It's more about if we are trying to prove a small case, and if you are able to at least show some thing is moving in the right direction. I think generally people resonate. Okay, even irrespective of which work level they are. So yeah, that's what from my side, that example.
Thank you, Tanmay. I think I completely resonate with what Tanmay said. It's a couple of things, right? One, I would say probably it's a cycle. One, you nudge employees to build a survey, get the data, get the baseline data. You use that as a strategy to pitch to the leadership in terms of your budgeting, your investment for next year. How would you want to enhance your benefits for your employees, your care for your employees? In turn, it should also be a top-down approach in terms of what the CEO is trying to, communicate, and what is their strategy, what is their objective for employees. Not just, that I want to grow a business, but I would want to grow a healthy, employer work-life balance and ecosystem that I would like our employees to have. So it's a cycle. You have the data, you be a strategy master to your CEO, ensure that, they have a buy-in on that one, bring in as a part of discussions of what you've been trying to enhance. What we've seen is, when we start trying to build something and it kind of works very well, they would want to replicate the same thing in the rest of the other locations. So if that's precisely goes very well, and you also become a partner in hand for rest of the other locations, and you try and see how the market could be in sync, or what are the other nitty-gritties or nuances that happens in the rest of the locations, and how you could probably learn, and at the same time, is there anything that you would want to bring in to your location which is quite different next year? So I think it goes well in terms of learning the strategy, the objective, and ultimately going to the care of holistic employee care and approach. So that's from my end.
Aditya, you have something to add?
Yeah, I just a small point which is sort of maybe adjacent to what Tanmay and Sati already spoke about, which is sort of the core of execution I think they're addressing. I just wanted to add in something which may get overlooked. Um, I feel like in our public discourse, health is somehow due to our culture, practices, and beliefs, health is mixed up with a lot of beliefs which may or may not be, what is the current state of the art thinking, right? And of course, this is not just an Indian thing. There is a whole anti-vax movement taking place in the US with even some scientists, involved, which is I find ridiculous, but everyone tries to learn and make up their mind based on their judgment, right? So I do feel we talk of awareness as a sort of a standard thing. Every company tries to run some awareness sessions. But I do feel there are some of these places where people's thought process is not very clear, right? Should I get an HPV vaccination? Is the vaccine company just trying to sell it in India, right? And then should I get the nonavalent or the quadrivalent variant? What is really needed in the country? Surprisingly, still the awareness level, even amongst administrators and HRs, is many times lacking, right? And to forget about employees who need to be convinced that it's the right thing for them. So I feel some of these, we can't take awareness building as just, one of those matter of fact things that there's the same old WHO calendar of 25 things a year that keeps repeating. We need to really think about addressing some real questions in people's minds, right? Is LDL more important or HDL? I mean, half the world thinks it's one and the half the world thinks it's the other, right? Or saturated fats. So I do feel there is a lot of work that ideally we need to be doing to refresh people's knowledge up to, what is the current state of thinking and remove some of this confusion and concerns. So I think that also helps drive the right kind of adoption through the year, right? And I think it's important. Sorry, and I had a second point, maybe adjacent as well. I feel that awareness building, at least I personally feel we are bombarded by a lot of health facts or news, which can be a little hyperbolic at times, right? But at the same time, there's some reality which is also very stark. Like I was just looking into the health checkup data aggregated for our customers, and 40% of them qualify as at risk of heart disease, right? Abnormal levels of the key markers for heart disease. And surprisingly, the difference between 20 to 30 and say 40 to 50 is very minimal. It's almost 40% in each. So I think that awareness building with real grounded Indian data is also super important. And this data keeps changing. I mean, the stuff around liver risk was not, nobody thought about it 10 years back that NAFLD would become such a big concern. And now we're seeing like NAFLD risk in Hyderabad being 50% of white collar employees. Like, sounds like crazy. So I don't know how much people pick this up, where they pick it up from. And maybe as employers, we can channelize a little bit better on targeted awareness building. I do believe it drives sort of more serious adoption of a lot of interventions as well.
Okay, so let's do a quick poll here. What is your number one barrier to implementing effective preventive care program?
Well, you missed out an important aspect in that poll option, ignorance about importance of health, because occupational health has chronic effects, and the consequences of chronic effects are dangerous.
Okay, so yeah, apart from the very genuine answer, which is low employee engagement, we see budget constraints, lack of leadership buy-in, complexity of measuring ROI, which is what we are going to discuss next, and infrastructure limitations. All of these could be addressed, but what about measuring the ROI of the wellness programs? Now that you've taken the program, the leadership team gives you a go ahead, you have a budget, you have the right partner. Now, how do you measure the impact? Do you have like a sweet spot? You've identified a sweet timeline that I'll give it 12 months, I'll give it 24 months, and do you have that much timeline from your leadership when you are implementing or designing a wellness program for your organization? Sandy, you want to go first?
Sure. See, I think in terms of technology, which can show you that, I have implemented these many engagements or these many activities or enhancements to our existing, benefits plan, and this is how the productivity has gone or improved, that technology is yet to kick in. I don't think that we currently have that kind of a data. However, I think more in terms of getting a pulse check from your employees of, how did they feel about this particular either a benefit enhancement or a session. It could be a more a financial session or a mental session or a mental well-being or maybe any other activity. Or like I mentioned, it was part of the annual gathering that we conducted a annual health checkup, which kind of help them first complete their check and then come enjoy the rest of the food or the party or anything that could be. So what was their consensus? It was more of a pulse check which helps us in terms of getting that ROI data of whether if it is successful, whether will it be receptive, or should we continue or should we put a full stop over there. I think that just gives you a pulse check. And I think very simply saying, to build that, there are a lot of firms which I know that they're investing in terms of how do they showcase an ROI more in terms of productivity levels and utilization of your resources, and how that has probably minimized your sick or unexpected leave of absence or anything. That is still yet to be, I don't know, introduced maybe, but once introduced, I'm sure that every company would like to have their take on that. Uh, until then, I think the only way I would know would be in terms of getting a pulse check.
Okay.
Okay. See, I will say there are two, three things simply we can start with this. We can go into further detail depending on the evolution of the company. We can see, suppose let's say organization, a lot of companies are nowadays having this is a given in the service sector or let's say the sophisticated and evolved organization. But even for all, yeah, I'm taking the entire scenario of the holistic sector point of view. Uh, Group mediclaim, group personal accident, GTLI, and all these things. Okay. So one of the metrics I will say, again, I know I'm right now talking about the lagging indicator, not the leading indicator. Lagging indicator in terms of, let's say, claim ratio. Okay, what's the movement? What is the movement of claim ratio? That is one of the ways. Or let's say cost per claim, because there are some specific 80-20 Pareto even works here also based on my tilted experience. So we can always look at that particular trend. So this is from a financial point of view, or let's say when my CFO will discuss with me, he will be more interested. Any new renewals are coming or anywhere we are going for it. These two things he will be more concerned about this particular part. From a business impact point of view, those India is already covered, but just I'm telling that it is possible in terms of my kind of sector, the manufacturing sector, definitely sick days, or let's say as Anand said few minutes back, the occupational health, which is becoming now more core area in coming days. So what are we doing in that particular front, or what are the preventive measure which we are going for it? Even though if we are able to have a particular matrix which we are able to define it, no need to go for too much complexity. One or two this thing on a productivity gains, it is going to help. And on a, you can say, topping on the pieces, let's say anything related to engagement levels, because today it might be very given thing for a lot of companies, but it is not so common for all this type of benefits being given by the companies when you are looking at the overall ecosystem. So even this is also one of the drivers, okay, in terms of, yes, my company is giving parental insurance. This is not a very simple thing. Very few companies are really giving it, or let's say my company is not limited with. But so engagement level and obviously your overall brand equity is going to be built up in coming days. Now, We don't require to do pom pom about everything. Yes, I am giving XYZ things, I am giving this, all these things. But I think the moment we are able to create impact and our own employees are becoming ambassadors for us, and my company is doing this much, that particular thing is coming from them, then I think we have served the purpose for it. We don't require to go for a hardcore ROI kind of it. I think these are the things, according to me, this financial part, the engagement part, and also the impact, which I can't ignore. So these are the three top things which are coming in my mind as far as ROI is concerned. But yeah, if organization is really matlab, on a different level altogether, awareness as well as adoption level, then you have to go into more specific ROIs. You have to go with the more utilization, which type of utilization, what is that utilization impact, and those things we can go into more specific leading indicators in that case scenario.
Aditya, you want to add something?
Not really, I mean, it's mostly covered. I see Mr. Anant has made a very valid point, sort of syncs with what Sandy said, which is genuine sick leave, which can become a little tough to distinguish as well. I do feel, besides the financial impact of hospitalization, utilization of benefits, which gives us a clue, this is probably a powerful indicator. As Sandy said, systems are not really designed today to do this very effectively. We integrate with HR systems. We just pull the employee data for endorsement. We don't actually pull sick leave data to try and give a health. Maybe we need to learn from manufacturing, where some of this is probably tracked a little more rigorously, right? The impact of absenteeism on the lines and productivity, etc. But I do see, hopefully in the next year or two, some of that will materialize in a way that brings more concrete measurement in place.
Aditya, just small thing where, as he rightly said, Anand, genuine sick leave. So I will tell you, there is a typical problem. Okay, I'm basically based out of Bangalore. In Karnataka, this thing, state government leave rules. So CL/SL.
I
Okay.
know.
Coincidentally, people, because they are not having a separate leave as a CL, so people are using SL. So we have to be very careful, but because so as you rightly said, we have our own tracking mechanism where we not to monitor or policing on the people whether it's a genuine SL or not. At least now we have made it sure it's a slash, it's either of the things because of the constraint of this one. But let's be genuine about it. If you are really not well, at least we will try to educate the managers that they don't require to go into this type of things. But sometimes it is a limitation, and if you are not explicitly telling 7 plus 5 or some split of 12, then people are by default using it as a SL, okay, sick leave. So that is also on a lighter note. I just said, okay, this is a typical dilemma of manufacturing industry, unfortunately.
I agree. We've seen that as well. Yeah.
Okay, before we end and open to some questions if we have, all three of you, do you have a story where a wellness program or a preventive care program changed an employee's life or made like brought a big change in your org culture?
I can share one incident. See, in my last organization, one of the guy during this checkup time, he came across that that person is HIV positive. Now, in a normal scenario, it has been first of all that not only that person was terrified, but overall there was a dilemma in the HR team as well as some of the other colleagues also, how to address this, because this is not something generally people don't want to speak, or sometimes they are having their own apprehensions or their own limitations. So we double sure, we because there is a specific test which has been done for this particular thing. We double sure with a better this thing, just to reassure whether there's things, there is no any error in this in terms of this thing. Finally we found out that that was the thing. So we ensure that there is a sanctity which is being maintained. It is not been disclosed in terms of confidentiality. And even the guy came and reached out to us and he said, sir, please don't tell to my family and all these things. So whatever things the person suggested, we said, boss, we are more concerned about how you can be getting the right measures rather than what is there. Now, let's not be there. So we suggested in terms of whatever right things we can do it from company side in terms of consultation or having the right assistance. And that person, so it was never been revealed, okay, in front of in a larger domain, because it was a, and I think that person still in touch, and he was always telling me, I think really appreciate though it was because in lot of companies, one or the another way, people will try to get rid of this type of people. Matlab, not by this thing, but they have their own set of fundas in their own setup that no, we don't want to go for this thing. Person is absolutely fine. That person is still this thing. He is taking his own measures, but he was very thankful to us, at least because of this test. Otherwise, I would not have come to know, or let's say in a stage 2 or stage 3, when it would have been difficult to cure. Okay, though that is not a 100% cure, but still I would have been in a different matlab situation altogether. So that person is always thankful. So this is not something which is to take a pride of it, but yeah, we are sometimes feeling somewhere we have touched a life which was a little bit difficult for them to express, and that person is really thankful. So I think this is something which I am able to recall immediately the moment you asked this, Minkasha.
Thank you, Tanmay. Thanks for sharing.
Maybe a quick one from me. You've heard this before, Pinkasha, but it's a different audience. My first job, I was like probably 22 or so, and leading a team of 30, 40-year-olds, 35-year-olds, right? Your typical sales setup in FMCG. And one of my KPIs was made the BMI of my team. Now, interesting, right? This is like 20 years back. And our sales head at the time, you would find him in the gym every morning. So he was very, and HR was also progressive. So I remember having conversations with these 40-year-olds saying, what are you going to do to reduce your weight? And it was interesting. At the time, it was like a very unheard of thing. And it did spark a lot of jovial conversation within my team saying, chalo, jogging ek saath shuru karte hain. Otherwise, the boss's KPI, they would say, boss's KPI will get impacted. So we need to do something about it. It was an interesting quarter that we did that.
Well, I probably will take my own story because, this was many, many years ago. So I utilized the annual health checkup that the company had, and given that, we had a discount, I went for it. And that's when I realized that I have thyroid and the levels were, significantly high. And only after that is when I got to know I did have thyroid, issue. And then, of course, the treatment started on thereon. But I don't think I would have probably, diagnosed that because unnecessarily, the symptoms at that time was not observed that either a hair fall or a weight loss or putting on weight or anything. Nothing was standing out for me to specifically go. It was just a part of one of the annual health checkup, and I just thought, let me use that opportunity, and that's how I figured out. So I just have my own story to say that that's how it helped me.
Very similar to your story, Sandy. It's a very recent one for me. So we have this partner called Twin Health, and they are a metabolic disorder reversal program with an AI technology, and they introduced a evergreen program for Pazcare employees and their family members. So I enrolled my mother, and they did a health check for her, which we used to do every year, and she was diagnosed with fatty liver, and now she's also having the hepatitis B infection, but that's just at grade 1, which can be treated, and this has been diagnosed very early. She showed no symptoms, and now she's on medication, and we're sure she's going to pass it, and this is going to go soon, before the symptoms could have become very serious, and she's already in her 60s. So I'm thankful that early diagnosis of this infection actually gave us the chance to treat this disease. So that's from my end. Any questions?
Sorry, that's
Yeah.
really good. And probably just adding to what Aditya said, right? Aditya, how things turned out maybe later is not something that I added. So I was in Pink of Health before I figured out this one. And then kind of after I got to know about thyroid, it kind of, went down south. But I did become a much more a sports person, I would say, probably. I am a marathoner. I would probably now say that, I'm in a Pink of Health. I'm much more fitness enthusiast, if I may say so. Yeah, I think, like I said, going back to the discussion of longevity is what people focus for. It's not about, momentary or short-term benefits that we look for. Having to see your own reports every year on year nothing in terms of demarcation, which is like showing either high or a low, is also important thing of how it's not, like I said, just a stepping stone or an end goal in itself. It's just a continuation of that. So yeah.
Nice.
Well, I
Sorry,
want to
go
share
ahead.
something very candid. During my tenure as the global safety leader in GE, in the John F. Welch Technology Center, we had this weekly health walks. And GE has a movement called HaHa, Health Ahead, Happy Always. And every Wednesday afternoon, 2 to 2:40, there used to be a walk. And we used to invite all amongst 5,000 employees in that center to come for a walk, join. And the first thing that used to happen to the employees is pick the phone and say, Anand, what's a goodie today? Because after every walk, people used to get a goodie. So that sometimes entices people, but yeah, but the challenge was how to convert a physical goodie to a health goodie, like change over from an umbrella to a plant or to an energy bar or to a health drink at the end of it, right? So people get lured due to this, and this can be one technique, but it should not be a binding factor. And for a few weeks, sometime in 2014, we said no goodies, and it dropped down. So you need to create a lot of these enterprising ways to do it, but yes, of course they are. And started marking on the road that you walk this distance, this many calories are burnt. And people and employees in corporate are number sensitive. So something that works, because that's on the positive side of enticing people to get into health movement in the organization. And I found it pretty nice. And slowly it becomes a way of life. After lunch, every day you walk this many meters or kilometers, or walk from this calorie mark to this calorie mark inside the premises. So that's something that I've seen in my personal experience. Thanks.
Yeah. Because I was just reflecting on Sandy and your experience, and sorry, it just came to my head. I think I had to share. I realize we need to be grateful that our body as a system gives us so much time to fix stuff. Actually, it's not like a machine which will directly break down. It's doing the predictive, the signaling so well in advance. So maybe instead of thinking about ROI, because then you have to fall sick in the next year to really show the ROI. But I think we should be grateful and sort of pick up on these signals from the body. Is a nice way of looking at it that I think we can positively deploy. It's interesting to see both your stories of catching things early.
Yeah. Thank you, Sandhya. I think Sandhya has a hard stop, so we'll let her leave. Thank you so much for your time, Sandhya. It was
Thank you
lovely.
so much, everyone. Thank you. Thank you. It
Sandhya.
was nice being here. Thank you. Bye-bye.
Okay, I don't see any questions on the chat. Anyone would want to share their experience? And then we'll just summarize and end today's session.
I think we are well over time, so yeah, we could close.
Okay.
Apologies,
All
everyone.
right.
Went a little over.
Sure. So just summarizing today's conversation, start with data, have a baseline of some metrics, then design your programs, have the right partner, and then give it time, stay patient, stay consistent. That's the key. And very, very interesting ideas we got to hear today from Tanmay, Sandy, Aditya, Anand. Thank you so much, even Sujata. So thank you all for participating, and have a great evening ahead.